Good morning, viewer. As a breaking news, in a paper published in the Lancet Oncology, a research team led by academics from the University of Birmingham in collaboration with the universities of Bristol and Edinburgh has analyzed data from almost 1 lakh female survivors of cancer who had been diagnosed aged 15 to 39 between 1971 to 206. From that cohort, between 1997 and 2022, there had been 21,437 births recorded among 13,886 women who had survived a cancer, which was 32% lower than in the general population. Survivors of some cancers saw less than half the expected numbers of births, including breast and cervical cancer. The data show that most expectant mothers saw a low likelihood of developing a complication in pregnancy or during birth, although there was a greater risk for leukemia and cervical cancer survivors who were at increased risk of multiply complications. Other specific cancers generally carried a low risk of complication. To ensure that cancer survivors looking to start a family receive support and assurance about managing any risks, the researchers recommended that formal guidelines were introduced, including ensuring that cancer survivors who are at risk of complications receive consultant-led antenatal care. Dr. Raoul Riolin from the Institute of Applied Public Health at the University of Birmingham and lead senior author of the paper said, "In the largest observational study of its kind, we can see that women who survived a cancer are still less likely to give birth than women in general population. Women may experience increased worry about the risk of complications during pregnancy and delivery following a cancer diagnosis. Our findings suggest that cancer survivors who did not have cervical cancer or leukemia can feel reassured about their risks going into pregnancy, as they do not greatly differ from the risks in the general public for the majority of obstetric complications. However, depending on their previous cancer type, some survivors were at a higher risk for one or two types of complications. For example, our study found survivors of kidney cancer had an increased risk of gestational hypertension. Only survivors of cervical cancer and leukemia had an increased risk for more than two specific complications from among the 27 complications investigated." We hope these findings can provide evidence for the development of clinical guidelines relating to counseling and surveillance of obstetrical risks for female cancer survivors. Beyond this exclusive report.